She thought the hardest part was over when they rolled her out of surgery. But weeks later, the pain is worse. The fever is higher, and nothing makes sense. Every step feels like something is tearing inside her. And deep in her abdomen, hidden where no one can see, a piece of surgical sponge that should have been thrown away is still there, rotting slowly. This all began in a bright operating room with a small miscount, a tired team, and a mistake that nobody noticed until it was almost too late. These stories are dramatized, but based on real types of events that can happen in hospitals. They are meant to raise awareness about medical errors and how we can learn from them. They are not medical advice. Always talk to your own doctor or nurse about your own health and treatment. Lena is 32. She is in a hospital gown, lying on a narrow bed, waiting for her surgery. She is having a routine abdominal operation to remove her gallbladder. The team says it is common. They do it all the time. She is scared, but she tells herself, this is modern medicine. I'm in good hands. In the pre-op area, people move quickly. The staff talk about schedules, other patients, and how many surgeries they still have today. In the operating room, it is bright and cold. The team puts on gowns, gloves, and masks. A large table holds metal instruments, clamps, and small white sponges used to soak up blood. A nurse counts them out loud before the surgery begins. The number is written on a board, the starting count. This is the safety net. Every sponge that goes in must come back out. The surgery itself goes smoothly. The surgeon removes the gallbladder, checks for bleeding, and talks calmly to the team. But Lena bleeds a little more than expected, so they use extra sponges to control it. The pile grows. The count becomes harder to follow. A phone rings in the background. Someone mentions the next case waiting. Pressure builds, even if nobody says it out loud. The surgeon says, "We're done. Let's close." The nurse checks the sponge count against the board. The numbers are close, but not perfect. She pauses for a second. Maybe one was thrown away in a trash bin. Maybe one is folded under others. Maybe she misheard a past count when someone was distracted. For one brief moment, she feels a small doubt, but the room is moving forward. The surgeon is already closing the incision. The clock on the wall keeps going. The next patient is waiting. She makes a choice. It's fine. The count is probably right. She writes down all sponges accounted for. No one in the room realizes that one small, blood-soaked sponge is still inside Lena's abdomen. At first, recovery seems normal. Lena is sore, but expects to be sore. She moves slowly, takes her pain medication, and tries to follow instructions. But after a week, the pain does not get better. It gets sharper. She feels tired all the time. Eating makes her feel sick. A deep, burning ache grows in her stomach, like something is scraping her from the inside. Her family tells her, "You just had surgery. It takes time." She tries to believe them, but then the fever starts. Low at first, then higher. Cold sweats at night. A smell she can't explain. This does not feel like healing. It feels like her body is fighting something. She goes back to the hospital. Doctors order blood tests and an imaging scan. She lies very still in a machine while it takes pictures of her insides. The room is quiet, but her mind is not. After the scan, the surgeon and a radiologist look at the images on a screen. There, in the middle of her abdomen, they see something that should not be there. A strange, fuzzy shape near the site of the operation, wrapped in scar tissue and fluid. It is a surgical sponge. The thing that was meant to save her and keep the field clean has become a hidden enemy inside her body. Lena needs another surgery to remove the sponge and clean the infection. She has to sign another consent form, face another anesthesia, miss more work, live through more fear. This second operation carries extra risk. Infection makes tissues weak. Scar tissue makes everything harder. This was never supposed to happen. The team removes the sponge. They wash out the area. They start strong antibiotics. Lena slowly improves, but she leaves the hospital with more than scars. She now carries a story about how a simple count, rushed and incomplete, almost changed her life forever. Lena survives. Her story is painful, but it bends back toward safety. Not everyone with something left inside gets that chance. Our next story begins in a different operating room, with a different team, and a patient who will not walk back out the same way he went in. Marco is 58. He is having major abdominal surgery to remove part of his colon. It is a complex case, scheduled late in the day. By the time he is rolled into the operating room, The team has already done several long procedures. They are skilled, they are experienced, they are also tired. The operation takes hours. There is bleeding. There is scar tissue from an old surgery. The team uses clamps, retractors, and multiple large surgical towels and pads to hold organs out of the way and soak up blood. At the end of the surgery, the surgeon gives the signal, "Let's close." The nurse starts the final count of instruments and cloths. In a perfect world, the numbers match the starting count exactly. Tonight, they do not. A towel seems to be missing. They search the table, the floor, the trash. Someone says,
"We never used that one. Maybe it was counted twice at the beginning."
We can't be here all night. The patient is stable.
It's fine.
There is a moment where safety and speed pull in opposite directions. Speed wins. The count is adjusted. The patient is closed. After surgery, Marco never quite gets better. He has pain that does not match what they expect. His belly is swollen and tight. His fever climbs, then falls, then climbs again. The team thinks it is a normal post-operative infection. They adjust antibiotics, give fluids, watch his numbers. But nothing seems to fix the problem. His blood pressure drops. His organs begin to struggle. No one has yet said the words out loud. Did we leave something inside? They send him for a scan. He lies flat, pale and sweating, as the machine circles his body. The images appear on a screen in the next room. The radiologist leans forward. There is a large foreign mass in the middle of his abdomen. The shape and pattern are unmistakable. It looks like a folded towel, wrapped in fluid and infection. The fear that no one wanted to say is now sitting right in front of them. Something from the operating room never came back out. Marco is rushed back to the OR. This time the surgery is even more dangerous. His body is weak. Infection and toxins have been spreading for days. The surgeons open his abdomen and find the towel. It is surrounded by pus and damaged tissue. They remove it, clean as much as they can, and hope his body can recover. But sometimes, even when you fix the mistake, it is too late. His organs have been under attack for too long. His blood pressure stays low, even with strong medicines. His lungs and kidneys struggle to keep going. In the days that follow, Marco's room fills with machines. Tubes, wires, and blinking lights try to support what his body can no longer do alone. His family stands by his bed, holding his hand, watching numbers instead of his eyes. The team fights hard, but the damage from the missed towel and the infection it caused is too great. After a long, difficult battle, Marco dies in the ICU. On paper, his death might be called sepsis or multi-organ failure. But behind those words is a simple, painful truth. A piece of surgical material that should have been removed was left inside, and nobody noticed in time. Our third story is much shorter, but it shows the other side of the same problem. Here, the system works the way it was meant to, and a mistake is caught before it becomes a tragedy. In another hospital, another day, a team is finishing abdominal surgery. The surgeon says, "Let's close." The nurse starts the count of instruments and sponges, just like always. At first, the numbers match. Then she reaches the last line and frowns. One sponge is missing. She does not smooth it over. She does not assume it's a mistake on paper. She says clearly, "The count is wrong. We are missing one sponge." The room pauses. They check the table. They check the floor. They check the trash. No sponge. The surgeon listens and decides to look again inside the surgical field. He gently lifts a loop of intestine, and there it is, a small folded sponge, pressed into a corner, almost out of sight. They remove it. They repeat the count. This time, every number matches. Only then do they close the patient. Later, the team documents what happened. On paper, it is a near miss, an error that never reached the patient. To the person on the table, it will never be a story they know. They will simply wake up, recover, and go home. But the truth is clear. A calm voice, a firm, "The count is wrong," and a willingness to stop and look again may have saved that patient from weeks of pain, a second surgery, or even death. From Lena's hidden sponge, Marco's deadly towel, and the team that caught their missing sponge in time, some simple but powerful lessons stand out. In surgery, every piece of material that goes in must come out again. Counts are not just paperwork or routine, they are life-saving steps. Rushing, fatigue, and pressure to move on to the next patient can push people to say it's probably fine when something does not add up. Those are the moments when small doubts need to be spoken out loud, not ignored. Near misses matter. When a team finds a missing item before closing, it can be tempting to shrug and move on. But those stories are warnings of what could happen next time if nobody pays attention. And for patients and families, it is important to understand that surgery is not only about the main procedure, it is also about all the small safety steps around it. Counts, checks, and speaking up when something feels off. If you had to go in for surgery, would you feel comfortable asking, "How do you make sure nothing is left inside me when you're done?" Or would you stay quiet because you don't want to seem difficult or scared? Sometimes one honest question, from a nurse, from a doctor, or from a patient, can be the thin line between a clean surgery and a foreign object left behind. And that question might be the reason your story ends in recovery, not in regret.